Hello, I'm Dr. Megan Melo. I'm a family and obesity medicine specialist practicing in Seattle, Washington, providing obesity care and weight management for people who are struggling with weight and metabolic health. And I'm here today to talk about what that initial visit looks like, because a lot of us may have questions. What is it like to work with an obesity medicine specialist? What I want to share with you is that our first visit is really going to be a deep dive into you and your life and your history and your struggles. It's a lot of me listening to your story. What weight struggles have you had before? What are any metabolic challenges like prediabetes that you're aware of? Tell me more about your relationship with food. What are you currently doing for physical activity, if anything? How is your mental health? How is your sleep? There are so many factors that we need to consider when it comes to thinking about a complex problem like weight. For far too long, the very limited science that was available on obesity medicine was pretty inadequate, if we're being honest, right? And the common refrain that patients have heard for so many years from physicians is calories in, calories out, that it really just mattered what the energy content of the food that you were eating was. And we were all told that we should exercise more. And if it's not working, then there must be a problem with us. That is not what the science shows. And I will throw it out there that most physicians never ever learned about obesity science or weight management. We did not ever have any teaching or instruction on it. So there are very real reasons why you may have gotten some of this messaging before, but let's be honest, it's also colored by patriarchy, racism, sexism, weight bias, gender bias, all sorts of other problematic issues. And so I think it's important to keep that in mind. And it's something that I openly talk about. We have had inadequate tools for so many years and a very inadequate understanding of the science that leads to metabolic changes that can contribute to weight. So if you feel like you've gotten these messages before about calories in, calories out, and being made to feel that there was a problem with you, that you lacked willpower, that you were just lazy, please know that I understand that this is the experience of so many people, and I do not do this. We do not do this here. The science shows that our weight and our metabolic health is so much more complex than we ever understood before, but we have learned a lot and we have better and better tools to be able to help people navigate these challenges. And we're going to talk all about that at your visit. So initially, even before I see you, you will have completed some paperwork for me that really sort of dives deep into both your medical history as well as the story of your weight. Were you overweight as a child? Is everybody in your family overweight? What is your relationship with food? Did you gain weight during the pandemic? Have you lost a significant amount of weight, kept it off, or did you regain it as most people do? We're going to get that history to really understand where are we today. Also at that visit, what typically is going to happen is I'm going to do some measurements. I'm going to do an exam. And what that is really just collecting some data. Yes, I'm going to check your weight. Yes, I'm going to check your height, your blood pressure. I'm going to look for signs of metabolic disease on your body. And please hear me that weight is simply a number, and it's a complicated number for so many people. You don't have to look at your weight or the body mass index calculation, which is also very problematic, also comes steeped in racism and gender bias. Unfortunately, in today's healthcare environment, I still need to look at those metrics because that is a language that I use to communicate with your insurance. And so, yes, those are metrics that I'm using, but we're also going to talk about what are the health goals? What are the life goals? What are the non-scale related goals that you have for you, your body, your health? After we've done those measurements, usually we're also going to arrange for some blood work. Those blood tests are really designed to help evaluate if there are medical problems that can be contributing to your weight gain, if there are medical problems that are caused by your weight. We know that there are very strong associations between some health conditions and obesity and overweight. And so we're going to be checking for those, really sort of getting a full assessment of your metabolic health. In addition, we're going to be talking, of course, about the foods that you eat, the ways that you currently move your body, ways that you're not able to move your body that you would like to, if we were able to help you meet those goals. And as I said before, sleep and mental health, because these are all pieces of the puzzle. When we have all of those elements together, then we're going to talk about the most successful tools for you. And that's going to vary for different people. For many people coming to see me, that might include medications. I use a variety of medications, some that you've heard about in the media, some that you probably haven't, in order to help meet different health challenges related to weight. So sometimes those medications are going to work on metabolism in order to, help overcome metabolic challenges like insulin resistance and prediabetes that may be contributing to weight gain. Some of those medications might be reducing food cravings or reducing hunger, improving fullness and satisfaction after you eat. So there's a variety of different ways that those medications can be working. We're going to talk about the challenges of insurance coverage for those medications. And I want you to be assured that even if you don't have coverage for some of the newer, more popular medications like Wegovy, there are other medications that are far more affordable as well as safe and effective. And so we'll be talking about those. For people who are interested in working with a nutritionist and really helping to do a deeper dive into the foods that they're eating, maybe get a sense of foods they might be sensitive to, I have a variety of really helpful nutritionist groups that I work with that can be very helpful in supporting our journey. Additionally, we're going to be talking about physical activity, what you're doing now, as I've mentioned, and what we recommend. We know that exercise is important for overall health, but surprisingly, exercise actually has a very small role to play in weight loss. Now, it is very important for weight maintenance. It is very important for maintaining strong muscle mass and minimizing the loss of muscle as we lose weight, right? There are many, many, many health benefits from exercise. And so we're going to talk about that. But exercise is not going to be the primary driver for weight loss. It might have worked for teenagers and 20-somethings some of the time, but it generally does not work after the age of 30. And the science shows that very conclusively. So we're still going to talk about it. We're going to set goals around it, but that is not going to be the primary driver for your weight loss. We're going to make sure that we're watching your overall nutrition, including vitamins and supplements for some people as we are working on this journey. And for those people who are interested in learning more about bariatric surgery, I, of course, can provide some information as well as referrals. So I want you to see that there's really a variety of things that we're going to talk about this first visit. And I am here to listen and work with you. My goal is to help us work together to find a solution that fits your life, that fits your health goals, that is safe and effective, and providing you with the information, support, and tools, including medications for some people, that you need in order to be successful. Calories in, calories out is generally not the way. And we're going to talk all about why that is. But I want to reassure you that we aren't simply going to say you need to eat less and move more. It is so much more complicated than that. And I want you to know that if you are already doing all the things, if you are already eating a balanced diet, if you are already exercising and you have been struggling to even lose a couple pounds with that, that is very common and it's not your fault. So I hope that gives you a an overview of kind of that first visit with me. If you are not scheduled for an appointment with me, but you're curious about getting started and you live in the greater Seattle area, I see patients for obesity medicine consults at Finney Primary Care and Wellness in the Greenwood, Finney Ridge neighborhood of Northeast Seattle, and I'd be happy to see you. I hope that this helps to give you some more information, and I look forward to seeing you. Take care.